About 20,000 people a year in the United States develop what we call a primary brain tumor. That's a tumor that starts inside the head itself. These tumors can be benign, they can be malignant, or they can be somewhere in between. Typically, they present with either headache, seizures, or a neurological problem, such as weakness, numbness, speaking difficulty, visual difficulty. Those are the tumors that start in the head. But there are actually over 200,000 people a year in the country who develop what we call metastatic brain tumors. Metastatic tumors are tumors that travel from a primary cancer elsewhere in the body through the bloodstream to the brain. So lung cancer, breast cancer, melanoma, a skin cancer, and kidney tumors have a propensity to do this and wind up in the brain. Almost always the treatment of a brain tumor begins with some sort of surgical procedure. The surgical procedure may remove and cure a benign brain tumor, or it may provide a tissue diagnosis for a tumor that cannot be cured with surgery alone. Well, fortunately, surgery has become much more minimally invasive and much less complicated. Almost all brain tumor operations are computer-guided. That is, we use special computer technology in the operating room to reduce the size of the skin incision and the bone opening that is needed to successfully remove the tumor. That greatly speeds the patient's recovery. It's not at all unusual for a patient to spend 1 or perhaps 2 nights in the hospital after successful brain tumor surgery and then return home feeling much improved. With computer-guided technology, much of which was developed at the University of Florida, we can take the patient's preoperative MRI or CAT scan. We can place it on the computer screen in the operating room. We can register the patient to the computer, and once we've done that, we have special probes. Wherever we touch the tip of the probe to the patient will be registered on the MR scan. So we can monitor exactly where we are on the patient's scalp, skull, or brain throughout the entire procedure. That enables us to select the safest pathway to the tumor, to ensure a complete removal of the tumor, and to keep the operation as small as possible, as minimally invasive as possible, speeding the patient's recovery from surgery. At the University of Florida, we do approximately 500 brain tumor procedures every year, and we have developed a technique for treating some tumors without the need for surgery at all. That technique is called radiosurgery. Radiosurgery is an outpatient treatment that involves focusing hundreds of small beams of radiation on the tumor through the intact skull. We began doing radiosurgery at the University of Florida in 1988, and since that time have treated over 3,000 patients with that technique. And again, it's often a very good alternative to more difficult open surgical procedures that can be performed on an outpatient basis. Now, we've treated over 1,000 metastatic brain tumors at the University of Florida with radiosurgery alone, and have extensively published our results. About 85% of the tumors are cured with one treatment. A spectacular result for an outpatient treatment method. If radiosurgery doesn't work, we always have a backup of surgical excision, which can work very well. We have a variety of extremely good treatment options for patients with metastatic brain tumors. And today, very much unlike the situation even 5 years ago, the overwhelming majority of patients with a metastatic brain tumor can be controlled and cured of that particular part of their disease. I think that one of the things that's necessary in a truly comprehensive brain tumor therapy center is pediatric brain tumor care. And that involves a pediatric brain tumor surgeon and a pediatric neuro-oncologist. Unfortunately, we have both here. David Pincus is a superb pediatric neurosurgeon who is an expert on all types of pediatric brain tumors. And Amy Smith is a dedicated pediatric neuro-oncologist who again provides one-stop shopping if any type of chemotherapy or biological therapy is needed after surgery. So pediatric brain tumor care is definitely a very important part of the Preston Wells Center for Brain Tumor Therapy. I should also mention spinal oncology. We have experts in our department on every aspect of spine tumor surgery, including spinal cord tumors or tumors of the spinal bones. We also have recently opened a spinal radiosurgery program where we use that radiation-focused technology that was developed in the brain to treat tumors of the spine. So we have wonderful options for patients with spine tumors as well within this comprehensive tumor therapy center. We're very fortunate at the University of Florida to have a brand new 30-bed neurointensive care unit that is absolutely state-of-the-art. It's a $10 million facility. All the rooms are private. Visiting hours are 24 hours a day for family, whom we encourage to stay with the patient whenever possible. And equipment is absolutely fantastic. So this is a first-class facility for our brain tumor patients and their families to spend their first day or two recuperating from surgery.
One of the things we do here at the University of Florida is see patients frequently and have an open door policy. And that's because even if the medical issues are going well, that may free up time in a scenario in which more emotional or quality of life issues then emerge. There might be different times where financial or insurance or logistic issues become paramount. And so by seeing patients and their families frequently, having an open door policy, being very closely involved with the referring physicians, we have that ongoing relationship where we can really problem solve in real time. We can identify issues and get them efficiently taken care of. Well, we're very proud here at the University of Florida to have created a position of a patient navigator. Whether you are a patient, a referring loved one, a referring physician, the diagnosis and subsequent treatment of a brain or spine tumor is fantastically complex. And so what we want to do is provide a one-stop location in a human that they can get to know, that can really be that navigator for them through the healthcare system. So a good example would be if they have to go to multiple different specialists, have different tests in different labs, the role of the navigator is to not only create those to be in the most efficient manner, hopefully the same date, the same time, but if not, be able to coordinate and problem solve with that family, loved one, or referring physician. Our goal is that that streamlines care and gives them a relationship of somebody they get to know through the months and years that we have the privilege of caring for them.
The successful treatment of brain tumors depends on more than top-notch, world-class surgery. After the surgery, we must be in a position to provide the patient with every other treatment option necessary to optimize their recovery from the brain tumor. We have worked hard over the past 5 years at the University of Florida to develop a truly comprehensive, one-stop shopping brain tumor therapy center. Fortunately, we obtained a very substantial philanthropic gift 4 years ago from the Preston Wells Foundation to establish a named brain tumor therapy center at the University of Florida. Using the proceeds from that gift, we have substantially increased the number of staff in our department who are full-time dedicated to the treatment of patients with brain tumors.
At the Preston Wells Center, adult and pediatric patients with brain and spine tumors receive state-of-the-art medical oncology care. Our dedicated team is proud to serve an active role in the tremendous advances being seen in brain and spine tumor care. The number one reason that patients, caregivers, and referring physicians seek medical oncology care at the Preston Wells Center is the presence of numerous exciting clinical trials. We offer a full complement of exciting Phase 1 through Phase 3 clinical trials, including unique combinations of chemotherapy, many with radiation, novel cancer vaccines, early investigations of promising agents, optimal rehabilitation programs, and fresh strategies to enhancing quality of life.
The University of Florida has expanded its institutional commitment to cancer in general by building a brand new hospital tower. It will include 180 brand new patient rooms, all private, new operating rooms, and clinic facilities for patients with all types of cancer. So this is a spectacular institutional commitment that I think bodes very well for our ability to care not only for patients with brain tumors, but for patients with some of those primary tumors that can lead to metastatic tumors, where we need our colleagues in other areas of oncology to help us produce optimal results. I'm extraordinarily excited about the recruitment of Brent Reynolds. Brent is a world-class, world-famous stem cell biologist. He and his mentor some years ago discovered the Neuro assay, which is used to identify neural stem cells.
My work is focused on making new discoveries of how we can stop brain tumors from growing. Everyone has stem cells in your brain, and they line the ventricles of your brain, and these are these fluid-filled spaces that you have within your brain. These stem cells can be activated to divide. We can activate them with drugs. They also get activated after the brain's been injured. And so we know that when your brain is injured, such as following a stroke, following a head trauma, those stem cells know the brain's been injured. They divide and they make new cells to an attempt to repair that part of the brain.
Currently, they're working on a method of using something called bone morphogenic protein to take tumor stem cells and encourage them to differentiate into non-tumorous normal cells. This is a very, very unique, novel approach to the treatment of brain tumors. We're very hopeful that it will lead to a Phase 1 human study in the next few years, and that maybe it will be the breakthrough that we've all been waiting for. From the surgeon's perspective, the opportunity to meet patients who have brain tumors and to be injected into their lives and the lives of their families is a wonderful gift. Taking a patient who's concerned, worried, as almost everybody would be about brain surgery, and their family through the process, having them wake up in the recovery room absolutely normal, hopefully with a smile on their face, a smile of relief, is absolutely the most rewarding part of my professional life, and I suspect the professional life of most neurosurgeons.